Okay, thank you for coming to this session. I'm Ruth DeFries from Columbia University, and Meha Jain from University of Michigan is the co-convener for this session. I just wanted to spend a minute or two introducing the session and then get into the talks. So when we think about land systems, we often think about the consequences of land use change in terms of ecosystem services, whether that's climate regulation or food and fiber or conservation and biodiversity or water protection for watersheds. And we think about the social dimensions, land rights or livelihoods and economic returns. We less often think about the human health consequences of land use change. That area falls somewhere between the public health community and the land use community, and consequently, it often falls between the cracks, which is why we wanted to have a session explicitly on this topic at this meeting. So if we think about the linkages between land systems and human health, there are a variety of pathways. These are just some of them. Air quality through fire emissions, the way we use the land for agriculture and the nutrition impacts, infectious disease and disease vectors, access to energy sources, fuel wood, and access to water affecting human health. So there are a variety of different pathways. I'm sure we can think of many more. So we are going to explore some of these pathways in the talks in this session. We have five full talks and one flash talk, and we are covering several of those different pathways that land use interacts with human health. So we will move right into the talks, and Meha will be doing the introductions.
I'd like to introduce Pam Jagger, who's an associate professor in the School for Environment and Sustainability at the University of Michigan.
Okay, can you hear me? Yes, no, maybe? Okay. All right, I'm going to talk today about some work that we've done on the topic of land use change and how it impacts people's ability to access fuel primarily for cooking and also for some small-scale industrial activities. I'll preface my talk by saying that I work primarily in very low-income settings, primarily in sub-Saharan Africa, which is what the topic of this talk is about. And these are settings where people are exclusively reliant on solid fuels, so that's crop residues, dung, firewood, or charcoal for household energy consumption. So these are not places where there's typically widespread access to electricity or liquefied petroleum gas or some other type of modern fuel. So the broad question is, as land use change is taking place, we know that there are typically in a lot of the settings that we work, reductions in biomass availability, and does that in turn impact people's ability to access energy resources and in particular the mix of energy resources they use, and does that in turn have some implications for their exposures to household air pollution, which is a primary burden of disease factor in many low-income countries. So that's the sort of basics of the causal model that we're looking at. So just to give you a bit of a quick primer, more on the public health side of things, exposure to smoke or household air pollution is actually the primary cause of morbidity and mortality in a large number of low-income countries. There's been a lot of information in the press in the US lately about the impact of fires and their contribution in terms of air pollution. Several studies out of Indonesia. So, we have very good evidence that these exposures to both ambient and household air pollution are a major, major health issue for people. The reason for that is that all of these processes related to incomplete combustion have high exposure levels of carbon monoxide, particulate matter, polycyclic aromatic hydrocarbons, and that in turn has implications for respiratory health, cardiopulmonary health, neurologic disease, eye issues, etc. So we have an attribution of close to 5 million deaths annually on the upper bound of the estimates. It's the largest environmental risk factor that we have globally at this time. So this is a very big issue. This is some work, a picture from some work that we do in our field sites. We actually collect data, objectively measured data on personal exposure to smoke or household air pollution. This is a filter that went into a particulate matter sampler, white, like pure white as snow, and after 24 hours comes out with a very sort of thick layer of particulate on it. This is what people are taking into their airways as they're cooking over solid fuel fires on a daily basis. So it's a very big issue and a major health factor that we need to think about. So a lot of the work on household energy access has really focused on what I would call demand side factors. So how many people are in the household? How much labor do they have available to collect firewood? What are their needs on a per capita basis? And very little research has looked at the supply side question. So as we have changes in land use, what are the implications for people's ability to access energy in general, but different types of energy in particular? So the work that we've done has really tried to look at, as we see fairly large-scale changes in land cover, what are the implications for energy access? As energy access is changing, so if you're going from a situation where you were previously collecting very high-quality firewood, and now because of deforestation you're burning maize cobs, that has, or the hypothesis is that that has some implications for your overall air pollution exposures and in turn the health outcomes. So again, this is the model. We have some land use change typically resulting in loss of biomass. This results in a change in the fuel use portfolio, and that in turn has implications for your air pollution exposures, your health, and one of the other outcomes that we look at is the amount of time that people have to spend actually investing in fuel collection. So this is work that I've done with collaborators in Uganda, and this is a map of Western Uganda where we've used MODIS data to look at land use cover change over this time period, 2003 to 2011. And, you know, basically anywhere that you see color that's not that background beige, we have some fairly significant land use land cover change. And we have a series of field sites that we've been collecting household level panel data in over time during this analogous time frame. So what we see is that in all of these sites, with the exception of one, we typically have reductions in forest cover and fairly large increases in cropland. So deforestation is the broad pattern that we observe. We've been able to estimate the reductions in biomass availability using data from Uganda's biomass inventory. And this is the sort of overall trend in terms of just per hectare biomass availability. And as you can see, the story is that it is declining, and it's declining in a very significant way, particularly in this middle field site that we've been working in. So what does that mean for energy access? Basically, we see a change in the portfolio of fuels that people are using at the household level. So, you know, we've got these four categories: wood from the forest, charcoal produced from the forest, firewood access from non-forest areas, so agricultural lands or wastelands or fallows, and then people that are using crop residues. And what we've seen in our household survey data is that over time, this category of collection of fuel from non-wood areas, so sort of marginal areas with lower biomass availability, has really gone up. We also see an increase in the use of crop residues in the areas that we're working in, which is what you would expect because of this large-scale conversion from forest to agriculture. What we don't see is a change in the actual quantity of fuel that people are using. So it's not that people are reducing the amount of fuel that they're using, it's for cooking, right? So typically you have to cook, and you cook every day in a similar way. But we do observe, along with these changes in portfolio of fuels used, we observe fairly significant increases in the amount of time that people invest in collecting fuel. So this is just to verify when we put this in a multivariate regression framework that we do see, as there is a transition from forest to cropland, we do see fairly significant reductions in fuel that's sourced, high quality fuel that's sourced from forests, and increases in fuel sourced from non-forest areas. Now, what does this mean for health? What we were able to do was look at respiratory infection, the prevalence of respiratory infection in both women that are engaged in cooking and children under 5 in our sample. And what we see, just to get to the punchline, is that this significant increase in fuel wood that's sourced from more marginal areas, so typically what we would consider low quality wood fuels, is associated significantly with a higher incidence or prevalence of respiratory infection. So as people are transitioning to these other types of lower quality solid fuels, it's having an impact on their health. So we explored this, just to skip forward, we observed this trend in Uganda, and we thought, okay, well, we better see if we can find some evidence of this in another site. And so we've done a little bit more work exploring this question in Malawi, which is also a country that has fairly high rates of deforestation, particularly in the southern part of the country. And again, so we did two things. One is that we looked at national scale. So we combined land use land cover change data, again from MODIS, with data from the Living Standards Measurement Survey. This is a population representative multi-wave survey that takes place every 4 to 5 years in Malawi. And what we tried to do was understand, as patterns of fuel use change, or as patterns of land use change are occurring, what are the implications for how people are using fuels? And what we see is sort of clear evidence that people are transitioning to more purchased fuel wood in areas where deforestation is taking place. But we don't see much more in terms of, and then in areas where we have regeneration, we see a higher incidence of collected firewood. To link this to the health outcomes, we've used household survey data that we ourselves collected that has a lot of detail on the different types of fuels that people are using. This is for a sample of about 700 households in Malawi. And using charcoal as the sort of referent case, what we see is that in cases where people are relying more heavily on crop residues, and in particular lower quality firewood, again, the prevalence of all of these health-related factors associated with household air pollution is high. So what does this mean? One is that we need to do a better job of collecting data on energy access, and by that I mean more information on just information on more than just what is the primary fuel used in your household, because people are using a lot of different things, and we're failing to capture that in most of our data collection. Second is that we would say that not all biomass is the same. So when people talk about solid fuels and their contribution to household air pollution, there's no acknowledgement that there's this heterogeneity within the portfolio of solid fuels. And then I would say also that we do a really lousy job when we do actual primary data collection on making sure that we collect information on health outcomes. So that's one thing that we can all do a better job of. I would also say, with high relevance to this group, that we need to be thinking about the health burdens of deforestation as one of the social costs of deforestation. And so I would encourage that we sort of try to get that into the policy discussion. And then finally, and one of the contributions that I think our work has successfully made in terms of policy impact is trying to convey the message that if you have a limited budget for targeting clean cooking interventions or tree planting interventions, it's quite strategic to do it in areas where high rates of deforestation are, which of course intuitively makes sense, but you can strengthen this argument by actually saying, you know, we could mitigate some of the health burden associated with these transitions if we focus our efforts in this way. Okay.
Yeah, we have time for 2 questions.
Hi.
I just wanted to clarify a few things. You talked right at the beginning about up to 4.8 million deaths a year. Now that's not just in poor communities, right? That's global.
That's globally, yeah.
Okay, so that includes people sort of breathing crap in New York City as well.
It does, yeah.
Okay. Now when you're looking at Uganda, and you're talking about the shifting from good wood to perhaps you could tell me what they're shifting to, because I wasn't quite clear on that. You said fallow, and I didn't quite know you mean grassland or something like that. But is the forest wood is not good for them either, right? I mean, it just happens to be better. Is that the gist of it, or are they okay with burning forest wood in their homes?
Yeah, okay, so two things. One, just to clarify, the estimates on morbidity are actually, that's for household air pollution exposure, so it doesn't include ambient exposures for people in New York City. The majority of household air pollution exposures are in developing countries, and the 5 million is an upper bound estimate, but this is more than deaths from malaria, HIV, tuberculosis combined. So it's a big health impact. Okay, so we've had a lot of discussion with reviewers of these papers on what is high quality versus low quality firewood. And so all firewood burning is bad for people, that's true, but there are different combustion processes associated with high quality versus low quality wood fuels. So people would be using wet wood, for example. They would be using smaller pieces of wood, and if all else equal, sort of high quality, dry, firewood like you see stacked beside houses here in Switzerland, as compared with wet twigs and branches or green wood or things that people are, collecting from these more marginal areas. There is a substantive difference in terms of how those things burn and what the sort of overall emissions or exposures are associated with the use of that wood. And we actually have relied on our survey respondents to tell us what's high versus low quality, because they have a very qualitative understanding of what's good for them, burns relatively well and dry and less smoky versus other things.
I think that's all that we can take.
Okay. Yep.
Next, I'd like to introduce Ashwini Chhatre, who's an associate professor at the Indian School of Business.
Cannot figure out. Okay. Those who can't hear me, raise their hands so everyone can hear me. I want to report on a relatively large and ambitious research program, many parts of which are being dealt with by different subsets of these eminent people. I am here trying to give you a sense of where we are at the moment and where we are trying to go. The health part of it is relatively new for most of us. We are trying to grapple with this. We are looking at human health from an output point of view, but the data is really poor and quite bad. What we want to do in terms of the ambition is to look at the interactions between land use, property rights, social welfare programs, climate shocks, and economic development. Okay, that should have been easy since I submitted the abstract, but I found out it's worse than a three-body problem, and even the math doesn't quite work out. I just want to take a few minutes outlining how we are approaching this, because what we have tried to do is two things. One, we mapped out these linkages to some detail, although we can't do all of it, in the context of rural India, where all of us have work, and at least we know when we are wrong. Second, we are trying to find data to test evidence on linkages between small chains within this complex network of cause and effect. And I have results on some of these causal chains and linkages, but we are, it seems, nowhere close to putting it all together. So what I would like to do is spend as few minutes here trying to describe what results we don't have, and try to put it in the form of a question so that if you have any ways that you have tackled any of these simple questions, I would love to know. If not in this room in the next few minutes, then outside of this room for the rest of the day. When I say land use, we are looking at two things. One is forest cover that provides energy. Like Pam says, most of rural India continues to depend on biomass fuels and contributes significantly to air pollution related morbidity and mortality. But we are also looking at land cover in terms of agricultural change and crop change dynamics and the expansion of irrigation that is linked to other elements that we care about. When we talk about property rights, we want to incorporate the rights regime and the tenurial regime that provides access to forest, and that is not the same for everyone. And there are gender differences in how access to forests and access to energy itself is mediated. When we talk about social welfare policies, we are primarily looking at the provision of subsidized food that has implications for food security and something that provides daily calories for hundreds of millions of people, poor people in India. But we are also interested in the impact of the recent push in the last few years of move away from solid fuels to liquefied petroleum gas as a heavily subsidized government initiative, similar in magnitude to the subsidized food initiative. So it's providing a way out, or at least providing a new pathway to reduced air pollution exposure and therefore improved health impacts, in addition to provide cheap calories. And by cheap calories, I mean cheap calories. There's a nutrition element to it which has been exacerbated because of these empty calories that are provided for free or practically free by the government. Climate shocks is straightforward. All the others provide coping mechanisms, and in many cases, the only resources that poor people have in terms of access to forests in times of climate shocks. So one of the links where we have made the most progress in the last year or so that we have been working on these questions is to establish that poor people access forests more than non-poor people. They access them more during climate shocks. They access them more during the rainy season, and they access them even more during climate shocks when total rainfall, total cumulative rainfall in the first half of the monsoon is less than 20%. And there are different measures that we have tried. Finally, we are also grappling with economic development. Parts of India are witnessing economic increases in income, highly heterogeneous. Some rural areas in India have seen no growth and degrowth and migration or deprivation. Others have witnessed quite significant increases in household income, even for poor people. They remain on the bottom quartile, but their absolute income has increased significantly in real terms. And that has contribution for their ability to both purchase good food that has health implications, as well as invest in fuels that are non-polluting. So move away from collecting fuel from common property resources or using crop residues and invest some of that income. And we have seen a lot of that. We have body of solid evidence and other people who have worked on this to show that as people's incomes increases, they invest more in meat, vegetables, and fruit, and they also invest in sort of the energy ladder, the climb up on the fuel ladder towards cleaner fuels. The relationships between these 5 elements, land use, property rights, social welfare, climate shocks, and economic development, are often different, sometimes with different signs of impact for different social groups. So that's another dimension of complexity that we are grappling with. There is a large proportion, especially in rural areas that have forests and people have access to forests, which are heavily populated with constitutionally scheduled and designated marginal populations that are designated for both social protection and affirmative action. These are people by definition that have been historically marginalized and dispossessed, that do not have enough land or assets or resources to deal with either climate shocks or policy shocks. What we are trying to do is first at least create a toy model, and we have had some success with that in terms of just these relationships and whether they are different for different sections of people, socially or economically, and then pick the most important links that we believe will fill out this overall matrix that leads us to an estimate of how each one of these interacts with each other to impact human health outcomes for poor people. So, I mean, that is the general focus. The pathways here are indoor air pollution, access to nutritious foods, and sufficient income to invest in livelihood strategies that take care of health. What we do not do here is account for actual healthcare policy in terms of prevention or tertiary care, and we are not taking into account access to off-farm jobs, which at this point in our assessment do not appear to play a major role in the interactions that we are interested in, although they are of course important to people who we talk about. So I actually could go on, and there are all these graphs here and there, but eventually what I want to do is leave more time, and well, I'll just stop there. Yes. Yes, yes, both. So firewood and food, meat, vegetables, and fruit.
What were the impacts on nutrition? What kind of data are you using for that?
So we have, just like Pam said, the livelihood standards, LSMS. So in India, there's a National Sample Survey organization that runs these thick rounds every 4 or 5 years. We are using rounds from 2004-5, 2009-10, and 2011-12, where 2009-10 was a serious drought year with 2/3 of districts under severe drought. And we are combining it with other kinds of data. Now, this is consumption expenditure survey, part of it, which asks for a total of 400, more than almost 500 different single items in terms of quantity and how much of it was home produced, purchased from the market, accessed from the subsidized food system, or free collection. For most of these things, free collection often means either stealing or borrowing, but for fruits, vegetables, meat, and fish, and in places in rural areas, we are assuming that this free collection comes from common property resources, which in most cases are forests in India. That may not be true everywhere. So we have very precise information on what people are consuming. For 1 month before the date of survey, we have date of survey that allows us to tag it to climate shocks and other things going on around them. Yeah.
You said you've been having some difficulties in coming up with some results that you're happy with. And so I wonder what kind of modeling frameworks you use at the moment to look at these paths and the structure of the system.
So there are three. One is the the simplest one that we should actually try to give up, the regression. So we assign one variable as the dependent variable and throw everything at it and see what comes out. It's like shooting alpha particles on a gold foil. Some come out the other end, some bounce back. The second one is matching analysis. So we look at outcomes such as the household dietary diversity scores or total iron consumption and many others. There is a suite of health-related outcome variables that we are trying to look at, and then see what is the average treatment effect where we assign treatment arbitrarily as climate shocks, as access to subsidized food, as distance from road, or poverty, and so on and so forth, with the others as matching variables, and see if there is a pattern emerging. And there is a pattern emerging, it's just that I'm unable to describe it adequately in 5 minutes. The third one is system dynamics, where we try to use this data to, or use the so-called causal loop. We are not sure about causality, but at least there is correlation that we can establish from the data, and then see if we can design trees based on which we can then look for those links. What we don't find, for example, is in our matching analysis, we find that people who collect from forests and don't collect from forests have no difference in iron consumption, zinc consumption, intake, and so on, which we believe is because it, or at least our interpretation is that it would have been a lot worse if they didn't have access to forests. But how do you do that in a modeling framework?
Could you not construct maybe some counterfactual based on some assumptions of...
So we are trying to construct the counterfactual from within the data to find households as the counterfactual who did not get climate shocks, who do not get free food or subsidized food, who do not have access to forests, one at a time, and then compare it to those who have access to free food and access to food from forest and so on. So it quickly escalates.
So is the problem that for each of your different locations and for each household they will have different policies, so you don't...
No. These policies are national. There may be policies that are different, but at least the kinds of policies that we are looking at are, and we think are important, are uniform and national.
And they're uniformly implemented as well, like at a sub-national level? Because if you had some that were implemented better than others, maybe those ones would be counterfactual?
Yes, so we have that information in the data. So we know what is the entitlement for free food or cheap food, and we know how much they actually received, which is an indicator at an aggregate level, for the district level, an indicator of the efficacy of that policy. So we use that to characterize district as highly efficient, well-governed. We use night lights to characterize degrees of economic activity and wealth. So we are throwing everything at it. But yes, but we should talk. Thank you very much.
Next, I'd like to introduce Tatiana Loboda, who's an associate professor at the University of Maryland.
Thank you. All right, so I'm going to pivot a little bit from previous talks and talk a little bit about malaria landscape and examining the role of land cover and land use change in that parameter. So we do have good news about malaria, right? Although malaria is really not a sexy disease that everybody gets excited about, it has killed more people globally throughout the lifetime of the humanity than just about anything else. And it has been declining. We've been very successful. It looks better and better, and the World Health Organization has a very optimistic target of complete malaria elimination by 2040. But at the same time, there is some very disturbing developments going on. And on the one hand, there has been an increase in malaria occurrence globally across all ecoregions. since about 2014, and we don't know exactly why. And the even more disturbing development that's very recent is the documented emergence of genetic mutations within the parasites that make them resistant to the current drugs. If those parasites, which now currently are only in Southeast Asia, if they do jump into Africa, like they've done twice already, we're going to lose the battleground and we will have to restart malaria battle again. So in that context, Myanmar really takes a very special place. Not only that is the country with the heaviest burden of malaria currently in Southeast Asia, it's the one where we do have documented multiple epicenters of emergence of drug-resistant parasites. Moreover, because Myanmar has been really cut off from the global community for so long and they're just now reintegrating into the global community, there's comparatively very little known about the processes, including land use science, that are going on in Myanmar. So in some ways, we're starting from scratch and trying to understand what's going on. I come to malaria from the risk modeling community. For years before this, I modeled risk of wildland fires in different areas. So in the risk is a complex structure, right, that encompasses hazards, exposure, and vulnerability. What is important to understand about malaria is that it is caused by a parasite, which is a true parasite, the Plasmodium. In this case, this is Plasmodium falciparum, the more deadly of the two, of the more than two, but the main ones are falciparum and vivax. What's important to understand is that it is true parasite and it cannot survive for any length of time outside the host body. And to complete its life cycle, it has to be in both mosquitoes and humans. And it is important to understand that in terms of understanding malaria transmission. Up to now, most people have always focused on one of the components, where the mosquitoes are. Mosquitoes by themselves do not equal malaria. Where people are, people by themselves do not equal malaria. You literally have to know where all three components are present to be able to account for malaria, right? And so what we have found is that land use that happens on the land really impacts all three components of malaria risk. What we don't understand at this point are the mechanisms through which these impacts are happening. And this is what we're just now starting to try to disentangle. And what I'm going to show here is our initial hypothesis that we're setting forward in terms of how these things happening that we're going to be testing moving further. So my study area for this particular presentation is Township, which is located in Rakhine State on the western part of the Myanmar. And yes, this is the region where the Rohingya Muslims are and where the ethnic violence is. Our study site is completely outside of the impact of the ethnic violence and therefore does not represent any militant action or anything associated with that disruption. So here, this is a Buddhist population which is very much subsistence-driven and with the highest prevalence of malaria in the country. And the data that we're basing our analysis on comes from a survey funded by Bill and Melinda Gates Foundation, which surveyed 5 villages, but don't be confused about the number of 5 because it looks very small. That represents 990 people whose blood was collected and tested for parasites. It's a huge amount of actual individual data. So when you start looking at just the individual level, what are the predictors of malaria? And we have the 990 people sample size. The gist there is there's only one predictor, and that's people have to be of working age to be infected by malaria at higher rates than everybody else. And the working age in that area starts at about age 10 because kids rarely get education beyond the primary school and they join their parents right about the age of 10. There is no difference in sex, there is no difference in any other parameter, so it's the working age. And working age implies that it's going to be associated with exposure and their occupational exposure. That particular survey had an additional question, and it was a very limited question, which targeted the understanding of where do people spend their time when they're outside the home. And we had 5 options: plantation, farm, forested area, mine, and refugee camp. Nobody ever went to the mines or refugee camps, so we're left with 3 options. And once we start looking again at the individual level, here's the big answer, right? Those who go to the farm and are involved in farming are clearly disproportionately getting much more malaria than everybody else. And of course, it's not that easy. It's never that easy, because those results hold true only for one village, whereas the rest of them are completely like, nope, had nothing to do with this. More disturbingly, we have about half of our sample size that don't go to any of those places, yet they still get malaria, and they're still somehow involved in occupational exposure that we're not accounting for. So we started looking at the landscape surroundings. What is it in their settings? Is there differences? They are very close to each other spatially, but we want to know what the differences are. And we're looking at the land cover fractional combination in different buffers. We're looking at the accessibility of areas. So we're looking at the 1, 3, and 5 kilometer buffers. We're looking at forest fragmentation within those buffers. And the quick punchline is there is no considerable predictive capability in any of those parameters, sadly. But there is a definite linkage between the loss of forest and the malaria prevalence at the village level, right? And I'm showing you beautiful R squares on 5 points, which is terrible, but that's all we have at this point. And we're going to have more, and we're going to test. This is formulating hypotheses, mind you. So recombining back these landscape metrics with the individual prevalence, we're back to yes malaria, no malaria rather than prevalence. We are able to create meaningful statistically models that describe who is more or less likely to get malaria on the landscape. And yes, it is a combination of percent forest cover that doesn't come out on its own, as well as the self-reported frequent visits to farm and forest. So the landscape context, in combination with the actual personal exposure, self-reported exposure, provides a fairly good indicator of who is likely to get malaria. But how does that actually decompose our impact of land use on different components of the malaria risk? And here's our hypothesis that we have built. The rate of deforestation, the very heights of rates of deforestation, indicate that most likely migrant population came into the region to conduct this deforestation. And the migrant population brings in new subpopulation of parasites. So your parasite pool is considerably larger, and they're not native, so the local people do not have immunity to those. So that's the impact directly on the parasite availability. Land use is also the dominant control on vector populations. So as forests shrink, you would expect the mosquito habitat to get worse, right? The problem is true for Africa. There's one dominant vector. Here you have 30 dominant vectors. They're all Anopheles. And as the forest Anopheles drop, the open land Anopheles comes in. So for exposure, what we have in terms of land use on the landscape does determine what people do. It's a metric. And so we are collecting better linkages between self-reported exposure and what we see on the landscape. And finally, vulnerability to malaria is also directly related to land use, and those remote, isolated rural settlements that are particularly involved in shifting agriculture and slash and burn. Those are taken out of the healthcare system, essentially. and those people get no access to healthcare. I wanted to acknowledge the sources that include NIH, NASA, Bill and Melinda Gates, my wonderful co-investigators, not all of them are listed, is the authors here, and I'm ready to take questions. Thank you. Yes.
I was curious, are you looking at any climate data since it affects the life cycle, and also like a temporal aspect, when mosquitoes bite and the people's exposure and vulnerability in that aspect. And then I wanted to ask you, but maybe talk to you later.
No, that's perfectly good question. And in fact, we have developed archive of 8-day downscaled measures of surface temperature, land surface temperature, and relative humidity, while looking also at the vegetation stress at the same time as a metric. So the climate in Myanmar is very interesting. There are 3 very distinct periods, right? And during the middle of each of those periods, the weather is stable. It's beautiful. It's being the weather forecaster in Myanmar is probably a wonderful job, right? You can put out forecasts for a month, and it's going to be there, and perfectly correct. But the shoulder seasons are much more complicated, and those are shifting, and capturing what's going on in the shoulder seasons is going to be very important. Yes?
I'm just wondering, I think there was a demographic and health survey done in Myanmar, the first one ever in maybe 2015, and sometimes they collect blood spots with those survey data. Is there a potential to do more national scale analysis if you can get those?
We are getting to the national scale analysis, but not for the demographic and health survey, and primarily because the blood spot data provides you the clinical expression of malaria, whereas in Myanmar, the majority of malaria at this asymptomatic subclinical level. So our medical team has to collect a lot more blood and run ultrasensitive PCR that is thousands times more sensitive to the presence of the parasites in the blood. And again, those surveys frequently exclude these challenging areas to get to, and those are the ones where the malaria is most rampant. Yes?
Well, the 2 simple ways of dealing with malaria I've always heard is 1, no standing water, and 2, of course, sleeping nets.
We have, yep, right. Yes, so quick answer to that is we are collecting information on the bed nets, but mosquitoes turn out to be an amazing little critters. So there is documented evidence that they have shifted their biting behavior from at night inside to outside at dusk. So bed nets, although still effective, and that partially explains why we don't have high malaria prevalence in very, very small children, because most of them actually sleep on the bed nets. At least they're reported to be. We do have most of the infection happening different time, different place, right? And standing water is really, when you have monsoon, you get standing water. There's very little you can do about that. But then Anopheles prefer having their larvae in running water, clear water, where the light penetrates, rather than the muddy standing water, although they have been known to be there as well.
Well, like Thailand had those big jugs where they collect the water, and they just had to do away with that.
So in the villages that I visited in Myanmar, I did not see any water collection jugs at the buildings, but that doesn't mean that they don't pull them out during the monsoon season, which I haven't been to. All right. Thank you.
I'd like to introduce our next speaker, Liying Guo, who's at the Center for Spatial Information Science and Systems at George Mason University.
Hi, morning. My name is Liying Guo. I work in George Mason University. My co-worker is Professor D, is also here, can answer your questions. My title is about urbanization, land use change, and Lyme disease. My presentation is also about disease, but it's another disease, Lyme disease. Maybe someone know about this disease. Lyme disease is a transmission about another vector, is a tick. This tick is black like ticks. So human be transmitted by these ticks by bat, maybe on your exercise by the tick. Mostly this Lyme disease happens in summer and late spring. The symptoms include fever, headache, and skin rash. We can find this picture. This picture open find your skin. You can find this sample. The Lyme disease, not like other disease, can kill the serious, maybe died or other things. But this disease is usually often take place when work outside and hiding, or work with dog. My research is just a part of my job. This presentation just about thinking and how we take this job, and why we found to detector is there do a relationship between land use landscape between Lyme disease. So the data from 3 paths. First, Lyme disease cases from the CDC. CDC is Centers for Disease Control. We can find from this link. The other data from population data from US Center Bureaus. The third, the last data, we can find land cover data. Land cover data from this crop data layer, CDL. This picture, we can find this short picture. From the CDL. CDL is an annual land use land cover classification data with a 30-meter spatial resolution. This data covers the entire US since 2008. Some places maybe early 1997. So first we can present the status of Lyme disease in US. All these data from reported cases. So we can from the left picture, we can find from the 200 and to 2014. We can find the total from 2000 and 2014. The numbers of Lyme disease cases is more than 500,000. So nearly more than 2,000 new cases reported annually in US. So the case is in rise. Most common vector-borne disease in the United States, so this has become a public health threat. The right picture we can find from first 1992 to 1996. Because the CDC surveys, CDC reported Lyme disease from the 1992. So first series to the last period, 2007 and to the 2011, we can find there's a 3 times increase. These 4 pictures about spatial distribution about Lyme disease. We can find from the 4 periods, each one is 5 years. So we can find the Lyme disease in the United States is focused on 2 areas. First is in Upper Midwest, another areas is in the Northeastern areas. So the serious areas most are focused on Northeastern U.S. These pictures about land use and land cover changes in U.S., in Northeastern U.S. So we can find the biggest land cover changes almost focused on metropolitan areas. We can find the right picture from South Washington, D.C. to North Boston cities. These areas focused on developed land. So most are around the metropolitan cities. This picture, we do compare the Lyme disease cases take place, and the other picture is about the land use and cover disease happened. We can find there's a coincidence overlays their picture. There's overlaid. So this give other thinking. Do the development changes to play a role in the increase of Lyme disease cases? We can find from these pictures the Lyme disease cases and land cover changes. So also take up these areas. So along the I-95 highway. We focus our study areas in Northeastern U.S. So we found all these Lyme disease cases focus on these areas. We can find from 1992 to 2016. The Lyme disease cases is increasing, and the areas always around from along the I-95 highway from South Washington, D.C. to North Boston cities. And we can find these areas also with dense population and higher urbanization. These details in information about Lyme disease in Northeastern. We can find some states the Lyme disease cases also increased more than 10 times. So we narrowed down our study areas in these places. So we can find this areas is a typical area. So with dense population and higher Lyme disease cases. So we designed our study areas to a buffer with 50 miles each side along the 95 highway with the fastest land use changes and higher urbanization. So these areas is the typical areas we focus on. Okay, quickly. So this, we do the spatial features. We found there is clusters about these areas. So we based it on these three clusters. We did the sub buffers. We based it on this. So from these three buffer zone 1 is less than 15 miles of disease from the county centers to I-95 highway. Sub-buffer 2, more than 15 miles, but less than or equal to 60 miles, and other sub-buffer 3. We do the spatial gradients features. We found there are difference from between the distance and between distance and Lyme disease cases. So this is another picture about this. This example, we zoom in the small areas to find there have a relationship between Lyme disease changes and land cover changes. So this summaries. We found the transmission of expansion of Lyme disease cases is in an increase in public health threat and an even distribution in the United States. We can find there's a difference between the distance to metropolitan areas and the Lyme disease cases. So that's all.
So we could take one question, I think.
It's just a quick presentation, so just thinking.
So I have a quick question.
Okay.
So the Lyme disease is related to the deer population because
Yeah.
they're the host, and increasing habitat for deer population is exploding. So the increase in the habitat for deer would be related to the increase in Lyme disease, you would think. So how does that relationship with increasing habitat for deer, does that conform with what you're finding in terms of the relationship between the land use change and the Lyme diseases?
Yeah, just I cited before presentation. There is just a part of our job. So we do relationship between land use and land cover change about and Lyme disease cases. So there do have a relationship, but is another part. Yeah, we do less than 15 miles to I-95 highway. There is a nice relationship between Lyme disease change, land use change, and Lyme disease cases there. But
answer your question. Basically, when urban development, suburban development, and people have more contact, you have a more bigger, converted forest use here in deer country. Now people invade and have more contact with that, so this get the increase of the disease.
Thank you very much. Our next speaker is Ozge Geyik from Deakin University.
Hi, good afternoon. I think I will change the direction a bit and talk about the determinants, one of the strong determinants of public health rather than the direct health outcomes. So yeah, I'm Ozge, coming from the University of Australia, and this is a part of my PhD research. I will give you a very brief introduction, talk about my method and data, and then present you my results, and then with discussion and conclusion. Over the last case, I brought about the so-called triple burden of malnutrition, where we have 500 million obese people, 800 million people suffering from chronic hunger, and 2 billion malnourished people at the same time. And although access to and utilization of food is very important to ensure food and nutrition security, production is nevertheless the very initial stage of dietary nutrient availability. And additionally, with the increasing role of international food trade, what is produced is often not consumed in its origin. And finally, different food commodities not only have distinct nutritional profiles, but they also have different environmental impacts. So in the literature, tackling those interconnected issues, we can see some commonalities, like they use aggregate food data, like the one, like food balance sheets from FAO, and they mostly focus on nutrient intakes of individuals, assuming some consumption and absorption distribution. And as such, they use food supply data rather than the domestic production. But we adopted that there could be some substantive information hidden in this aggregate data, and we want to also know the food sources of dietary nutrients as a result of the primary production. So my research questions are, how has the dietary nutrient production changed across time and space over the last 2 decades? And as a result, how has nutrient adequacy, which is just the ratio of the nutrient production divided by nutrient adequacy, population level nutrient requirements, and what are the food sources of nutrients around the world, and how have the patterns changed? So I used secondary data from different sources. I have crop and livestock production data from FAO Stat, and I have fish and aquaculture production from FAO Fish Stat. And then I have the technical conversion factors from FAO Stat for those commodities that need primary processing for human consumption. And then I have commodity nutrient values from US Department of Agriculture and refuse factors to account for edible amount of the food. So as a result, I have the dietary energy and nutrient production, combining those data sets. And then to calculate the nutrient requirements at the population level, at the national level, I have the demographic data and birth rates to account for different requirements for different gender, age groups, and pregnancy. And then I have used the joint FAO and World Health Organization guidelines, and I also included the adult weight, which is important for energy and protein requirements of the individuals. So as a result, I have the population level nutrient requirements. And in the end, I answer my questions by looking at the spatio-temporal trends in dietary nutrient production and food sources of these nutrients, and then combining those two, I have the spatio-temporal trends in nutrient adequacy. And as a result, I have 177 countries representing 98% of the global population, but I will present my results in 14 world regions. My time frame is between 1995 and 2015, and I have included energy, protein, iron, vitamin A, vitamin B12, and folate. And in the end, I have 313 individual food commodities, but I will present them in 9 main food categories. So here you can see the nutrient production trends, starting with continental Africa, and actually Africa shows the biggest increase among all other continents, and it is most dominated by sub-Saharan Africa. And then in Americas, there is a more subtle change, and there is also a slight decrease in South America, vitamin B12 production of South America. And in Asia, which is the second biggest, which showed the second biggest increase in nutrient production, is dominated by Eastern and Southeastern Asia. And then in Europe, again, the nutrient production trends are quite stagnant. And in Oceania, we see a slight increase in Australia and New Zealand. And as I said, I look at the nutrient adequacy by dividing dietary nutrient production by population nutrient requirements. And actually, we didn't find a very significant change over the last 2 decades. There is some improvement in some countries in South America and a few countries in Africa. But as I said, not much change. And that goes for protein, iron, zinc, vitamin A, and vitamin B12 and folate as well. And in the end, looking at the overall statistical results, we did not find much improvement. The median for energy, iron, and vitamin A is below 1, which shows that at least half of the countries included in the study have produced less nutrients compared to their requirements. And that shows that at the primary production level, more than 40% of the global population are living in the countries with inadequate production. And I will, as I said, I will present my food sources in 9 main categories. So starting with Africa, we can see that energy, protein, iron, and zinc is dominated by cereals, and vitamin A is dominated by roots and tubers, and marine fish is very important in vitamin B12. Oops, sorry. And in Americas, the vitamin A is coming mainly from milk, which is different than Africa. And again, vitamin B12 is dominated by marine fish, but the production is decreasing significantly. And in Asia, the roots and tubers and vegetables dominate vitamin A production. And in Europe, it's milk again, which is very similar to Americas. And finally, in Oceania, milk is dominating vitamin A production. But on the global level, roots and tubers and vegetables are very important for vitamin A production. So since sub-Saharan Africa has persistent nutrient inadequacy, and we want to take a deeper look at this region, and we see that vitamin A production has increased more substantially than compared to other nutrients. And when we drilled down into the food categories, we found that was the case for roots and tubers, not for the other food categories. So we wanted to see this individual food community that is responsible for this trend. And we found that sweet potatoes were very important in vitamin A production, and their vitamin A output has increased more substantially than the other commodities like cassava or yam, and that was because of the large vitamin A content of sweet potatoes. So it is just a small share of the overall roots and tubers category, maybe just representing 3%. But since it has substantially more vitamin A content per edible amount, even a slightly higher increase in the production of sweet potato resulted in a large increase in vitamin A production. Just to conclude, in summary, we found that the dietary nutrient production has increased globally, but still there are the pockets of inadequate production in several regions, like in Western Asia with vitamin A, iron and vitamin A insufficiency in Southern and Southeastern Asia, and in Central America and Caribbean, as well as South America. And then there is energy and vitamin B12, insufficient production of energy and vitamin B12 in the continental Africa. And cereals are still important for energy, protein, iron, and zinc production. Vegetables and roots and tubers are important for vitamin A production. And marine fishes, although its production has decreased, still remain to be an important source of vitamin B12. And we argue that targeted trade policies and measures are important to fill the gap. And accessibility and utilization is, of course, an important stages after the availability is ensured. And it's very important that the best use of what's produced is ensured, because at the global level, vitamin A production is only 20% higher than the global requirements, but thinking about the food waste, which is around 30%, we can see that we can immediately go under the global requirements. And environmental aspects should also be considered in the next step. And to conclude, substantive knowledge could be revealed by high-resolution data. Eastern, Southern, and Southeastern Asia, as well as Southern and Eastern Europe, are hotspots of nutrient production, which means they produce more than half of the total nutrients. And 40% of the global population are still vulnerable to nutrition insecurity. And cereals, roots, and tubers, vegetables, and marine fish, as I said, are main source of nutrients. And we can see that most of the nutrients are still provided by crops, not from livestock. And this is valid for other nutrients rather than vitamin B12, which is not provided by crops, of course. And in the next steps, we will look at the international trade and how it affects this balance. And we will compare the production and consumption. And I thank you for your attention.
We have time for one or two questions.
Thanks for an amazing presentation. One of the questions is, how much of this do you think we should be calling for policies that intervene in trade, and how much policies that intervene in fortification or staple flowers and things like that?
Yeah, actually, I mean, we haven't finished our analysis yet. So as I said, iron and vitamin A are very critical, both in observations, like these African and South Asian countries are suffering from vitamin A and iron deficiency. And also at the production level, our findings confirm that. Since we are concerned with the environmental impacts of the food production as well, we were thinking in our discussion for our paper that biofortification or fortification could be an option if we want to avoid some further environmental impacts. I mean, in Africa, where there is insufficient iron and vitamin A production, sustainable intensification could be another option as well. But as I said, there are trade-offs. So yeah, maybe if they can't afford trade to fill their gaps, then yeah, biofortification could be an option, and the literature shows that it's actually provides good outcomes. So yeah.
It's interesting that sub-Saharan Africa has had the biggest, or one of the biggest nutrient production increases, yet sub-Saharan Africa, as far as proportion of the population, has the highest rate of food insecurity and malnutrition, undernutrition, and the triple burn. I just wondered if you could comment on that. What do you think?
Yeah, if I understood you correctly, so yes, sub-Saharan Africa and also Northern Africa showed the biggest increase in nutrient production, but since their nutrient requirements have also increased and at a higher level than production, I mean, the nutrient adequacy levels haven't changed for Africa, for the continental Africa. So that was surprising to us as well, because I had to skip it very fast. But when we look at the percentage of population whose adequacy level is below 1, we see that over time it has actually increased. So this is not good for nutrition security. I mean, the number of countries staying below 1 has decreased, but then those countries who are still having insufficient production are the most populous countries with the highest population increase as well. So we have more people who could suffer from this nutrient inadequacy. Does that answer your question? Yeah. Thank you. Thank you.
For our last speaker, Nina Schwarz. She's from the University of Twente in the Department of Urban and Regional Planning and Geoinformation Management. And this is a flash talk, so.
I'll do my best. Welcome, everyone. I feel a little bit like a hitchhiker here because we actually had submitted this for a session on mixed methods. So I'm going to have one sentence basically on health. I'm sorry, but maybe this method could be interesting for you as well. What I'm going to do here is I'm going to report on a workshop that we organized. So me being Mike Lees and Karen Pfeffer and Deborah Stroy from University of Twente and University of Amsterdam. And we were looking at modeling deprived urban areas, so informal settlements, slums, favelas, however you might call them. So the four of us, we are basically agent-based modelers. So we were concerned with the state-of-the-art in slum modeling or modeling of deprived areas. For those of you who don't know what that really is, it's basically a simulation method that links people to places. So we have a spatially explicit environment, and we model heterogeneous individuals or households that are interacting and that are also interacting with their environment. It's a method from complexity science, and we can use that as a virtual laboratory to simulate bottom-up processes and emergent patterns. So for instance, location choice of residents leading to social segregation or emergence of slums. And we use these models for many reasons, like understanding systems, but also as an opportunity to explore policy options and potential effects of these policies, like upgrading of slums. There's very few applications for the Global South, unfortunately. Many topics that are very relevant for deprived urban areas are hardly addressed, like spread of diseases. Here's your health relation, or the effects of disasters in these settlements. And one of the reasons is that data to parameterize and validate these models are scarce. So what we need basically is to know who are these people, what do they do, what do they think, and how does this happen in space, and what are the spatial implications of this. So therefore we invited several colleagues from two different distinct fields. One field is ethnography, so colleagues who are doing surveys, interviews, analyzing biographies, and doing also participatory observation. I'm totally not doing them justice here, but like my main findings that they highlight is that we have multiple deprivations in these areas, of course. We have strong heterogeneity among residents, and also many different reasons why people live in these places and for how long they live there and so on and so forth. So that's a very much people perspective. And we also invited colleagues who are working in the field of remote sensing, who are mapping building densities, for instance, or roof materials to try to map slums or informal settlements. Their main findings or new findings are that we also have very small pockets of deprivation that do not link to formality or informality as such, but can also be placed within formal areas. And they see huge potential of combining remote sensing with big data, so social communication data, for instance, on Twitter and so on. There's many interesting things to say about that, and the challenges that we had, at least in starting to talk to each other, definitions, should we focus on people or focus on places, and how can we link all of this? Overall, we started with the idea that agent-based modeling, we wanted to enrich our knowledge about that and see how these two additional fields of research could link to that. What we ended up with was that actually we also found that even without the modeling perspective, these two fields would very much benefit from each other, but there's many challenges related to that. We talk about many people in these settlements. We talk about large areas, since we also need to understand how these settlements are linked to the overall formal part of the city. And the last point I would like to highlight here is that we also, the more data we link and the more approaches we link with each other, of course, we have a lot more ethical considerations to think about. Data privacy issues, that we stigmatize people who live in certain places if we put their place of living on a map as a slum, for instance. I would like to thank all our workshop participants for their contributions. We're currently writing this up in a small position paper, and of course I would like to thank you for your attention. I would be very curious to hear how your work on health and relations to land cover could potentially link to such an approach of putting people and place together in one method. Thanks a lot.
Okay, so we have 5 minutes. And what's been going through my mind as we've been hearing all of these excellent talks is we know that there are so many ways that land use links with health, whether it's disease, exposure, contact, where people are going, vector habitat, so many different pathways. And there's a lot of research to be done. And how, from a policy perspective, we could have the health ramifications of land use decisions integrated into land use decisions. And I'm trying to think how that could actually happen. Does anyone have any experience or thoughts, or any of the speakers or anyone else with how that health aspect of land use decisions actually can link? Because clearly people care about health, that's an important policy consideration, but making that linkage is difficult. Anyone have any thoughts?
Well,
here, and we'll go back here and then.
okay, thank you, Ruth. Something that comes quickly to my mind is the issue of land degradation, because most times I was listening to one of the talks in another session where they said people really care about their environment and nobody wants to live in a degraded environment. So most times the land use would feed into whether the land is degraded or is sustainably used, and this links also to the health of the people. Even the aesthetics, I mean, part of the ecosystem services would derive from living in a very clean, good, aesthetically nice environment.
Yeah, I can just say a little bit based upon our experience working in a few different places in Africa. So typically we try to convene people from health, energy, and forestry, or whatever the relevant ministry is in the country that we're working in. And it is very clear when we get those people together that they never get together. So, so that's one just sort of observation that I think makes it really hard to connect the dots. One thing we're doing with a lot of our exposure assessment data is that we're trying to package it in such a way that it's interesting to the health community and also to the forestry community, and trying to, at least we put together sort of policy briefs and trying to connect the dots for people, which, it's a bit naive to think that that's going to foster policy change, but at least it helps make some connections.
Ricardo, you get the last word.
Okay. No, forest is something very simple, but seems to be, and there is clearly a trade-off between the demand for agricultural products, which are relevant for health, and the environmental impact of that. But there are many places, geographically and conceptually, in which there is a win-win opportunity. The most clear example, Brazil has 200 million cows, I think. This means like 200 million hectares. And if you reduce and it's an extremely inefficient way to consume. If you change, for example, to produce pork, which is twice as expensive, you are saving 100 million hectares. And also, 80% of this Brazilian production goes to Brazilian consumption. And Brazil has a lot of problems because they eat too much meat. And we Argentinians too. So identifying these places where there is a win-win opportunity
final comment.
Just a comment on that. I think if we try to replace ruminant meat with monogastric meat, we also have to look which kind of land is used, because ruminants can be fed from grasslands and monogastrics from cropland, and I think that's a trade-off where you also have to consider, for example, the carbon stocks, which are also differently in grasslands and croplands.
Sure, and it's not that easy.
Nothing is easy.
Yeah, sure.
Meha.
And I just wanted to make one final point. This is unrelated, but one common theme that came through all the presentations is that we have a lot of great data on land cover, but really not that much good data on health. And there's only limited stuff that we can do by using LSMS or DHS data over and over again. So I think this idea of getting people to go out and collect new data and collaborate with public health scientists is really exciting.
Okay, well, one more thanks to all of our speakers and all of you for showing.